do they know the difference between sharp and dull? Okay, now at this point, go ahead and put her other foot on that stool there, just so it's not just dangling. Good.
Now would I have lifted this up so her foot sat on the bottom of this bench? You want it to dangle?
You wouldn't really even need that bench in there for this particular treatment.
Oh, okay.
It happens to be in there because this is the warm one.
Don't touch that. Take your gloves off first.
Careful how you do it. Remember, you're not touching anything with bare hands on the outside. So one off, two off. Okay.
Okay.
Okay, go ahead and turn it back off. We're going to pretend that it's on right now, but for the sake of the camera being able to hear us, okay, at that point she would adjust it so that it was hitting against the wound if we were trying to clean out the wound, because we're trying to get pebbles and things out of that wound. So it would be direct. The force would be as much as the patient could take comfortably.
I'd ask him, how is that feeling too much on there? Is that okay?
Yep. And then you could adjust the force or the aeration. You want as many bubbles as possible if you're trying to get the pebbles and things out there. Okay. So we're going to pretend that that's still going and it's hitting against her extremity and it was comfortable. So what's next?
Take your gown off.
Okay. I don't
So
think
again,
her
it's all
timer-
considered contaminated now, so
Okay.
you're going to be really careful to undo those and then use your inside. There you go. Okay, you can never reach inside. Okay, then what?
Set your time.
Okay, so the timer for 5 minutes, then you're going to come back and check with specific questions to the patient. What kind of questions could you ask?
How's your pain?
How's your pain?
How's the temperature?
How's the temperature? Is anything uncomfortable? Not just how you doing.
I'm doing that before or after the 5 minutes.
After.
So I would have gave her this and
Yeah,
told her.
you set the timer.
Give her
Yep,
that,
and then
okay.
give her that.
And then
And
come
15
back
more
5
minutes,
minutes.
you come back.
Okay. 5 minutes, we did all the questions. Okay. Now, set it for 15 more minutes. Okay. And then the last little bit of that 15 minutes that's left, you can start setting up. Okay. So what things does she need to get ready? Is it what's on there? Okay, I'll refold the gown
Okay.
where you get your clean gloves out. Make sure they're ready to go. Okay, so she has sterile gloves, clean gloves. Because she's going to need the clean gloves to get the patient out of the whirlpool. So make sure your clean gloves are out of your waist basket there. Okay, what else does she need?
My sterile field.
Yep, the sterile field, 2 packaged towels, sterile towels. Your gauze roll, and your gauze sponge.
Does she need to wash her hands before she gets all that stuff? Yeah.
No, not until she
No.
comes ready to work with the patient. Right now, she's setting things up to get them
When
ready.
she get ready, go back
She
to the
doesn't need-
patient.
Okay, now when you're getting ready to do this, you need to start thinking about where you're gonna put the wound and where you're gonna work on it. So you have a couple of choices. We can use this stool that the patient's foot is on. Is that a comfortable height for you? Okay, so that's one option. Another option would be one of these brown tables. You can lower it down a little bit. Obviously, you don't want it too high, but even that might be a little bit high to be up in that high seat and then have her foot raised up. We don't want her to tip backward. Okay, so my suggestion would be to use the stool if it's a leg. If she were sitting in a chair right here and you're doing an arm, then I would use the brown table because you can adjust it to where
Now,
you
where
want.
will can I sit in a chair? Because I don't want to be bending over.
Yep, you can bring one of those other chairs over. Okay, what's next? Okay, oh, you ready to put your gloves
You
on?
get-
Here, let me take the gloves off. All right. Oops.
Oh, I'm sorry.
That's okay. That's okay, we can leave it right there. Just readjust here. Okay, now we're ready for part 2. How much time do we have left?
We're rolling.
Yes. Okay, so she's been working with another patient. She has everything on the table here, ready to go, so now she's ready to start setting up to actually work with the patients. I saw you just wash your hands, okay? And what's next after that? Okay, so make sure the sterile field's ready. That means getting the bench ready as well as getting the sterile field onto it. Now, once she has that barrier down, she has to be a little bit careful not to, turn her back on a lot of things. But I will tell you, if the wound is on the lateral aspect of the ankle there, the foot is gonna be resting on here, but the wound isn't gonna be resting on here, so it's not like it was last time where things really have to maintain super sterile base here. Okay. It's good to have that so you don't have a lot of the exudate leaking onto the equipment down below, but it's not quite like before, where you had to maintain your sterile field sterile. Okay. The sterile field you do have to worry about though is the wound. You don't want to put your head over the top of the wound when you're working. Okay. All right, so make sure you have things set the way you want. Once you get her leg out, don't do it yet. Once you have her leg out, you're going to be turning her, and you need to be able to reach all your stuff here. So kind of have things where you want it. And I'm going to maybe have it just a little further back here so the camera can see what you're doing. Okay? All right, so you have things where you want them. Okay, what's next?
Down your gown.
Okay. Lots of room so you're not moving the tables there. Easier said than done, right?
Yeah.
Okay, once she gets the gown on, then what? Okay, make sure all the packages are ready to go that you need to have ready. Okay, so the barrier field itself can be put on the stool here. Make sure your gauze is open, your roll is open. They can stay in their own packages. And that's good, just pull it out now.
And I can touch
You can touch the outside with everything that's the outside. Okay, and with this, you're gonna put it in your left hand with the two folds toward you. Okay, so here's the two folds right here, that's gonna be toward you. Put your left hand right out. Just left hand right here. The two folds are gonna be toward you, and the blue stripes are over toward the left side. Okay, so the two folds are here, there's a bunch of edges here away from her. Okay, so now you're gonna use that hand to grab that corner, and this hand to grab that corner. That's the hardest part of the checkoff. It doesn't cooperate very well, so you're trying not to touch any of those other inside parts.
The one that's got the closest to the plasticky stuff in there, that's the side that doesn't want to come off. Well, there we go. Gotcha.
Okay, so you're just gonna let it drop, kind of make it go away from you, let it drop. Okay, make it go away from you.
Away.
Okay.
Oh, yeah, there we go.
All right, and that's gonna go right over your stool there. Careful that your head isn't over. I mean,
yeah.
you don't have to be totally sterile with this, but you know, try
Right,
to not
okay.
do that.
That's your freebie.
Okay. If you haven't, is this where they have the turning off the Whirlpool?
Yeah.
Okay. If you haven't already, you could have done this before, but you need to make sure that that's off. So now the Whirlpool turbine is off. What's next?
Down, clean gloves.
Okay, so the clean gloves are gonna be put on. Before you put on your sterile gloves, you need to make sure those other things are open.
Yeah, they are. But, I
Okay,
mean,
make sure
pull
those
it
are
back.
right over your cuffs. I will be looking for that again. Okay, what's next?
Take her leg out of the Whirlpool.
Now, patient, as she's turning you, and you tell your patient this, make sure this other foot just kind of stays back. And as you're bringing her foot, you have to kind of think about where your hands are, so that you're kind of staying off of her wound.
Right.
So go ahead and kind of help
And
her
it's
bring her
gonna
foot
drip
up.
onto that, is okay?
Yeah, you're just gonna do a quick little boop on over.
Here's her.
Put your head over the top of the wound though. Okay. All right, and whenever possible, it's good to use your foot, for moving things. That's a good way to do that. Go ahead and take your gloves off at this point, carefully, so you don't contaminate. Okay, what's next?
Get your sterile.
Could I move her chair if she needs to? Are you good?
Don't reach over her wound, though.
I ain't moving.
Why did you move it?
No, I just didn't know if she was okay.
I'm fine.
Cause I have to work over here, right?
Mhm.
Alright, anyway, so now I have to.
Sterile gloves.
Okay, let's,
We have
because
to
we
make
didn't do it
sure-
before, let's make sure these are open. Good. Doesn't you act like this at all.
Oh, that's not gonna go out on the thing.
No, you're just gonna leave it in the package for now. Just make sure it's undone.